Hello, and welcome to another episode organized by the Deta ELIS company for educating the public as well as practitioners in the use of bioresonance devices. Today's talk will be looking at bioresonance diagnostics and therapy. It's actually more geared towards the professional, the health professional, who wants to get into bioresonance diagnostics and therapy. We will be focusing on two devices produced by the Deta ELIS company, the Deta Professional and the Deta Pharma. Let's start with some basics. Let's look at what is resonance. Resonance basically means the matching of frequency. All living and non-living things have their own unique resonant frequency. So if we take a wine glass, for example, it has a resonant frequency of approximately 500 hertz or cycles per second. So if we can match that frequency like an opera singer with a high voice can match that resonant frequency of the glass will actually absorb the frequency and then it will burst. If we, this phenomena is called resonance. We find it in tuning forks, for example. So if we had a tuning fork tuned to the note C at one end of the room with a matching tuning fork C at the other end of the room, if we stimulate one tuning fork, then we will hear the other tuning fork at the other end of the room also playing, because there is resonance. We also have the phenomena of suspension bridges that resonate with the velocity of the wind, and they can actually fall and crash. So this is resonance. Now let's take a little look at what happens when we actually hit a wine glass with frequencies. This is an experiment that was done in the University of South California, and here we have a glass which, with a speaker behind it, that is resonating at exactly the same resonant frequency as that glass. We can actually see in slow motion how that glass is actually resonating and literally pulsating to the point when eventually it will smash. There we go. That is the phenomena of resonance. Now, let's look at what bioresonance is. All living things also have their own resonant frequency. So if we take a simple protozoan, for example, like a paramecium or an amoeba, if we can match the frequency of that protozoan, then it will absorb the energy and it will lyse, or it will break open. And this is an example of bioresonance. Here we have an image of a paramecium, and it's being hit with the frequency for paramecium, which is 1150 hertz. And we can see that the walls of the paramecium are beginning to bulge. This happens because the semi-permeable membranes of the cell wall undergo what is known as electroporation. Electroporation is where the walls start literally vibrating at quite a fast rate and start to weaken because they have very, very small pores. That's why they're semi-permeable, to help the exchange of nutrients for the paramecium to feed itself and excrete its toxins. So if we keep on hitting it with the frequencies, you can see the bulges get bigger until eventually the wall, the cell wall breaks open and we get lysing. Now, it will be interesting to actually see a video of this happening under a microscope. Here we go. This is the paramecium lysing after its cell wall breaks open. And here we have another one. It's being hit, as we said, at 1,150 hertz frequency. This is the resonant frequency of the adult paramecium. Now, this can basically happen with any type of microorganism in the body. This was proven by Dr. Reif many years ago, that managed to find the resonant frequency of over 55 different microorganisms. And he used resonant generators, frequency generators, until the point where he actually managed to identify the resonant frequency of the Bacillus X virus, which apparently he found in all cancer cells. And by eliminating the Bacillus X virus, he was also able to treat a number of cancer patients. Now, that was a brief introduction. What we want to do now is we want to look at one of the bioresonance diagnostic and treatment devices that are made by the Deta ELIS company, the Russian company that are pioneers in the field of bioresonance testing and diagnostics. This is called the Deta Professional. It is the top of the range, cutting edge, both treatment and diagnostic device. I have been in the field of bioresonance testing, diagnosis, and treatments for over 2 decades now, over 20 years. I have many different devices that I have been using over the years. I would truly say that if I had to leave in a hurry and go to a deserted island, and I could only take one device of the many devices that I have with me, the Deta Professional would probably be the device that I would choose. Now, why would I choose this over the Vega or the Bicom, which I also have? Well, just in parenthesis, this is probably the most cost-effective device for practitioners. It costs less than 8,000 euros. If we compare that to the Bicom, which is over 30,000 euros, and if we compare that to the Vega, which is only a diagnostic device, you know, and that retails around about 15,000 euros, you can see immediately just how cost-effective it is. Apart from that, it also has over 20,000 digitized ampules, which are digitized and stored in the Pharmaceutical Selector. We will be talking about this as we go along. What that means is that without having to take ampules with you or buy many ampules for testing, for bioresonance testing, you can do all the testing by using the algorithms for tapping into these digitized ampules. So let's take a look at this device. It has tremendous capabilities. There are many devices out there, and I have done another video, so if you want to Google or go to YouTube and search for Dr. Giorgio and bioresonance testing, I have actually done another video where I talk about the automated testing devices that are on the market, and there are many of those. I call them the lazy practitioner's way forward, because yes, they apparently do scan and bring a lot of data onto the screen, but it's very difficult to cross-correlate this data. It's very difficult for the practitioner to be in control and lead the way forward in order to identify the pathogenesis of disease. So, for example, in Vrt testing, and this is what we are talking about here, VRT testing is vegetative reflex testing. This was Dr. Schimmel's work after Dr. Voll, who probably is the pioneer in bioresonance diagnostics. But with the Voll testing method, he was using many acupoints all over the body, and there are literally hundreds. So it was a very time-consuming way of eliciting information from the body. Even though back in the 50s, when he had developed this, there was literally nothing else out there that could tap into and identify the pathogenesis and the causal chains behind the symptomatology of the patient. Then Schimmel came along, Dr. Schimmel, and identified that you could actually do the testing from one point instead of learning all the Voll points. And so the testing that the Deta professional can do, and the Deta farmer that we will talk about in a little while, is the vegetative reflex testing. You're using 1 point basically, and then if you want to test a parasite, let's say if the person has an amoeba, which is a protozoan, you literally place the ampule of amoeba onto the resonator pot or plate, or you can actually put an algorithm into the device, and if there's a resonant effect, then you know that the person does have amoeba, or does have ascaris, or does have a tapeworm, or does have any other type of parasite, or protozoan, or bacteria, or fungi, or viruses. So you can test the whole gamut of microorganisms and identify whether there is a resonant effect with the patient. You can also test for foods, food intolerance testing. I've said this many, many times in many videos that I've done over the years, that it is the biggest source of internal inflammation. I'll say it again, food intolerances are the biggest source of internal inflammation. So if you've got a chronic patient and you really want to get to the bottom of their problems and to eliminate chronic inflammation, which leads to chronic disease, then probably the first thing you do is you test for food intolerances. You can also do allergy testing for different environmental allergens like dust, dust mites, cats, dogs, other animals, feathers, and so on and so forth. You can also test all the organs of the body, and you can break the organs down into smaller parts. You can test whether these organs have inflammation or whether they have degeneration. You can also test the degree of inflammation and the degree of degeneration. This really puts the control into the practitioner's hands. It is not an automated device that brings a list of different things on the screen and then you have to prioritize, and also there is no correlation, or at least I haven't seen any studies for these automated devices that have actually cross-correlated with patient histories, blood tests, MRI scans, and other data collected by other means. This VRT testing has a history which is in excess of 60 years, and there are many research studies that have shown the efficacy of this testing. And if you look at the video that I mentioned previously, you will see some of those research studies. So here we have a beautiful way of testing for the pathogenesis of disease, that causal chain. What was the first domino that hit the second domino, the third domino, to lead to all these symptoms now that have created this syndrome of chronic diseases. You can test for a whole gamut of different things. For example, you have a patient who comes in and they have frequent urination, their urine flow has decreased, you suspect prostate. You can literally take the prostate ampule, the normal prostate, and you can test the patient for the normal prostate. If they have a normal prostate, then there will be no resonance. However, if their prostate is inflamed or is enlarged, then there will be a resonant effect. So you know that this patient's prostate has a problem. Then you can ask yourself the question, what is causing the prostatitis, for example? Well, if you look at microorganisms, chlamydia is a common one. So you can test for chlamydia against the prostate. If there's a resonant effect, then you can say, yes, chlamydia is one of the causative factors of the prostatitis. Then you can say, what about heavy metals? The person has a mouthful of amalgam, so they've just removed 3. Maybe mercury is an issue. You can place the mercury ampule, or you can use the algorithm for the mercury ampule, and you can test mercury against the prostate, and so on and so forth. So this is really a beautiful way of identifying the causative factors and the pathogenesis of disease. It's truly a holistic approach. The Deta Professional also has a therapy mode. So apart from the diagnostic capability, it can also do electromagnetic therapy, bioresonance therapy. We'll look at some of these concepts in the next slides. Electroacupuncture therapy, for those that are perhaps acupuncturists and are familiar with the acupuncture anatomy. Also quantum light therapy, which is using basically colored light, which is also frequency, of course. And it can take electromagnetic therapy, bioresonance therapy, and quantum light and put them together in a complex and treat the patient concomitantly. All of those together, and this is called complex therapy. I do not know of any other device on the market that can actually do these combinations all at the same time. So it really is innovative in that sense. It works with 220 volts. It has obviously an adapter to drop the voltage down to 12 volts. The Professional itself has different modules. So here, this is the Diagnostic Module, where we do the diagnostic tests in the VOL or the VRT mode. In the middle here, we have what's known as the Pharmacological Selector, and this is where we have the 20,000 ampules, all the organ systems, all the microbes, the ampules for testing whether it's inflammation, the degree of inflammation. All this work had been done by Dr. Vol and Dr. Schimmel, and we need to bow to these 2 researchers who were pioneers in bioresonance testing. And this is the therapy module. This is where you have all the buttons that you control for the electroacupuncture, electromagnetic, and the quantum light. And underneath, you have another panel which is for the bioresonance therapy, which is another beautiful therapy that I will talk about and explain. So you have the various connectors here. We won't go into all the details. Here we have further connectors. Here it is explained what these connectors in. For the first 2 are for the bioresonance therapy. The other one is for the output of the Pharmaceutical Selector. And then you have the electrodes, the hand electrodes or foot electrodes, whatever you're using. You have the probe, and on the side here you have 4 connectors for doing quadrant testing, as it's called, and we'll talk a little bit about that as well. So this is the panel that is showing us when we are doing the VRT mode of bioresonance testing. We will press the probe light. if we are doing the quadrant testing, where we're literally looking, we're breaking the body up into 4 quadrants. So we're testing which quadrant in the body actually has the health issues. And these buttons are for the quadrant testing. So if we want to go into diagnostics mode, we simply press the probe button. We put this into the diagnostics mode, and off we go. And we're ready basically to conduct bioresonance diagnostics in the VRT mode. There is sound as well, and it's good practice for practitioners that are just beginning to take their focus off the indicator and use sound to guide them regarding what the indicator is indicating compared to the sound. This is the this is part of the Deta Pharma, and it's called the Deta D. This in itself can be used as a bioresonance device. If you plug in a resonator pot and or resonator plate, and you have a series of ampules, there is no reason why you cannot use this. And it's very, very small and portable, and it's also battery operated. So you can literally take it to a place and set it up very easily without having any form of power. The Deta Pharma, compared to the Deta Professional, is only for bioresonance diagnostics. It does not do treatments per se. So that is the difference. This is only for bioresonance diagnostics, but basically it can pretty much do everything diagnostically that the Deta Professional can do. Because what you would do is you would take the Deta D, which is basically the indicator, and you would plug it into the Pharmaceutical Selector, which in the Deta Professional is inbuilt into one unit, but here there are 2 units, the Deta D and the Pharmaceutical Selector. Once you've plugged it into the Pharmaceutical Selector will also have those 20,000 digitized remedies or ampules inbuilt into the device, much like the Professional. So this also has sound. There's ways of testing it. If you just connect it up and you touch the probe to the hand electrode, then you'll get a reading of 100. You know that you now have a circuit, an open circuit. And this is the Pharmaceutical Selector. So the Pharmaceutical Selector connects onto the back of the Deta D, which is the indicator basically. You connect a resonator pot with the hand electrode and the probe. Now you are literally ready to conduct VRT bioresonance diagnosis using the Deta Pharma with all the capabilities of the 20,000 plus digitized ampules in the Pharmaceutical Selector. It can actually copy homeopathics. So if you have an ampule of a homeopathic and you want to copy it for the patient, then you can put your original ampule of homeopathic into the input resonator plate here, and then you place your water with a couple of drops of alcohol or your sugar pills or your lactose pills, your placebo basically, into this pot. And if you want the patient to be connected, then you can also take in the patient's pathological resonant frequencies that will also be imprinted into the output pot. And this, of course, these are inverted before they are imprinted to cancel out the pathological oscillatory frequencies, but we'll come to that in a minute. So using the Deta Pharma, you can actually copy homeopathics. If you want to make nosodes, nosodes are pathological tissues or fluids from diseased animals or people. An autonosode, of course, is a diseased tissue or fluid from our own body. So if we take a nosode, i.e. if we take a sample of saliva, or it could be a few drops of blood, or it could be urine, or it could be feces, it could be sperm, it could be vaginal swab samples, and so on and so forth. Depending on where the problem is in the body, we choose the nosodes appropriately. Then we can put the nosode in the input plate, and we can put our placebo, our sugar pills, into the output plate, and that will invert the pathological oscillatory frequencies that are concentrated in these nosodes, cancel them out, and imprint them into the homeopathic so that the patient can take those home and take the nosode homeopathics in order to continue the healing process. We can make homeopathics from the Pharmaceutical Selector. We choose the frequency of the homeopathic, and all these are provided as algorithms in manuals. So there are manuals for all the remedies you could possibly want to use in a lifetime. There are literally hundreds and hundreds. You place the algorithm from the manuals of these remedies that you want to copy, and you place your sugar pills onto the resonator plate here, and it will basically copy the resonant frequency of this frequency into the homeopathic. So even if you do not have ampules of homeopathics, the mother tinctures, if you like, you can still copy homeopathics. This is going back to the conversation that I began with. If I had to leave to go to a deserted island, what device would I take with me? I would take one of these devices, preferably the professional, because the amount of homeopathics that one can produce is ad infinitum. You can treat hundreds of people by just placing the algorithms of the homeopathics that you want to copy. And of course, the Deta Professional gives you the ability to do many other treatments as well, and also the diagnostics. So you can make homeopathic homochords. A homochord is different homeopathics all mixed together. Usually some of them will be at different potencies. So that is a homochord. So if you want to make a homochord of arnica, for example, let's say you're looking at 6, 12, and 30 C potencies, you can put here arnica 6C, the algorithm, store it, and then on the second level, you can place arnica 12C, store it, and then arnica 30C, store it. And then when you press the out button, it will take all of those 3 potencies of arnica, and it will imprint them or copy them into your sugar pills. So now you have a homochord of arnica that has been created from the algorithms that are present in the Pharmaceutical Selector. This is coming back to the Deta Professional. If we want to begin bioresonance diagnosis, VRT, Then we connect the probe, we connect the pharmaceutical selector, the output, onto the electrode basically here. So we now can place anything from the pharmaceutical selector and test it against the patient who is holding this hand electrode. If there's a resonant effect, then we know that that is positive, and they will have whatever we are testing against. This, I think we just said this. This is the pharmaceutical selector. So there are algorithms that are present in manuals for all the organ systems, for all the microbes, for inflammation, for degeneration. You can even go down to the DNA level. It also gives you the capability of measuring Bio Photons. This is Professor Pop's work, and Professor Pop showed that cells actually emit light, which he called biophotons. And as the cell gets sick, then the level of biophotons actually drop. This gives you the capability of actually going to a specific organ and measuring the biophoton level of that particular organ. So if the biphoton level is low, you know that you're dealing with a sick organ, and there is a scale which places it into how sick that particular organ is. So let's this is when we go into the Vrt testing, because when we first start testing, we're actually in the vol system of testing. But to jump to the Vrt testing, we just simply press this second button on the probe, and that immediately takes us into Vrt testing. The device is calibrated to read 80 on the indicator. In the vol testing mode, it was 100. So when you find the point, the resonant point that you want to test for, then there will be an indicator increase up to 80 when you're in Vrt testing mode. If you place an ampule, let's say the example of the prostate that I gave, so now you've touched the probe on the point and the indicator's gone up to 80. Then you place the ampule of the prostate, or the algorithms of the prostate, in the pharmaceutical selector. You test again, and there is an indicator drop. That means there is a resonant effect between the prostate. If it's a healthy prostate and there's a resonant effect, that means that the patient does not have a healthy prostate. If you are, and that's called an organopreparation. Organopreparation is a healthy organ or healthy tissue. If, however, you have a nosode, i.e. you have tissue of prostate from a patient that has had prostatitis, an inflammation of the prostate, or benign prostate hypertrophy, an enlargement of the prostate, and you get a resonant effect, then you know that that patient has that particular problem. So let's see what other capabilities the Deta professional has. Well, one capability is that you can bypass the pharmaceutical selector of placing in the algorithms and actually use physical ampules. So if you're testing for foods, for example, and you've got a food testing kit, which are physical ampules, then you can place the physical ampules in this resonator pot or this honeycomb, and you can set up the device as shown, and you can test against the foods. So if you find the point on the finger, the indicator goes up to 80, you place the food in the resonator pot, and there's a drop. That means that the person is intolerant to that particular food. You can, of course, test whether it is a food allergy or a food intolerance. But in the majority of cases, it would be a food intolerance because food allergies are much, much rarer. And usually the patient will tell you those because they've had the experience. Now, the way that we can determine whether there is an acute inflammation, and this is to do with the homotoxicology model, if there is an acute inflammation, is by using different potencies of the particular organ that we are testing. So let's come back to our prostate example. If we take an ampule of a healthy prostate at D3, and there is an indicator drop on bioresonance testing, we know that the patient would have an acute inflammation of the prostate. If we take an ampule that is D30 potency, or sorry, D30 to D60, and again we have an indicator drop for the prostate at this potency, then we know that the process is chronic. And if we have an ampule that has a very high potency of around 200D or C, then we know that this this disease process, if you like, what was once in the body, but now is literally an imprint. It's left a memory on the immune system. So we can still detect it, but there's no active symptoms of prostatitis or prostate difficulties. In homeopathic language, this would be called a miasm. So this is how we determine, using the different potencies of the ampules or the algorithms, because all these are also as algorithms that you can choose from the Pharmaceutical Selector on both the Pharma and the Deta Professional, and you can determine whether you are dealing with an acute process, or whether it's a subacute, or it's become chronic, or if it has just literally dwindled away. The quadrant testing, as I briefly mentioned, is a way of determining, it's a rough screening test. So if you're not too certain where the problem is in the body, then you can divide the body into 4 sections, and then using the quadrant testing, you can identify in what quadrant. So this is right hand, left hand. So right hand, left hand would of course be the thoracic cavity, the chest. So you'd expect to find organs such as the heart, the lungs, the esophagus, the cervical thoracic spine, etc. So let's say during the quadrant testing, you do indeed find a problem in this quadrant. Then using your bioresonance testing, you can then determine, is it the heart? Is it the lungs? Is it the esophagus? And you can specify those organs for testing, as opposed to going through all the organ systems of the body, which of course is very time consuming. So it's a good screening test to start off with, to say, aha, this is the quadrant of the body that we need to focus on, and these are the organs that are affected. Indeed, we can also determine whether there is inflammation, because once we've done the quadrant testing in all 4 quadrants and we have our numbers, if one of the numbers, for example, and here we are talking about the pelvic region of the body, if this number is higher than the other numbers, then that's an indication of inflammation. And during VRT testing, we found that this was prostatitis, for example, or it could be chronic appendicitis, which is also in the lower part of the body. If it's a degenerative process, then we will find that one of the numbers in the quadrant affected will be lower than all the other quadrants. So here we're talking about a degenerative process again in the pelvic organs, and we can then go ahead and do our VRT testing to determine what that is. So it's a crude screening test to determine where in the body, in which quadrant of the body, there are problems. And then we can go into that area and specify and test each organ individually. Now, this is how we set up the Deta Professional for bioresonance therapy. We basically have an input electrode and we have an output electrode. And we set our parameters. And what does bioresonance testing actually do? Well, the beauty of bioresonance therapy is that you don't actually have to identify the underlying causative factors, because what bioresonance therapy does is it takes the pathological oscillatory signals from the patient, and if this was a normal signal, it would literally be a sine wave like this. It will be a sine wave. However, if there are pathologies in the body, disease processes, then we get these spikes. And these are the pathological oscillatory signals. So we take in the pathological oscillatory signals through the input electrode from the patient. It goes through the device, and inside the device there are specialized electronic filters that can identify the difference between the normal sine waves and the pathological signals on these sine waves. So once it's identified that these are pathological oscillatory frequencies, it will invert, it will change, it will turn it upside down. And that's the green line. The red line is the pathological oscillatory frequencies. And once it's inverted it, then it will cancel out the pathological oscillatory frequencies. It will re-invert it as a clean sine wave, amplify it, and it will give it back to the person through the output electrode here. And of course this, it does every second, for as long as the patient is connected onto the device. So what we're doing is that electronically or energetically, we are cleaning up these pathological oscillatory signals that are causing the symptomatology. They're causing the pathology in the body, the disease. And it's a beautiful way of treating a person without really understanding the complexity of the pathogenesis of disease, the underlying causative factors, which can often take many, many hours to determine in very, very chronic sick patients. This is just a way of determining which hand or foot or which quadrant you will be giving the input and the output. So you just measure the energy from the thumb of both hands and the feet, or depending on what quadrant you're actually treating at the time. And if one is low, then that will be the input electrode, because energy flows from low to high. Sorry, from high to low. It's the opposite. Energy flows from high to low. So whichever is the higher reading will have the input electrode. Whichever is the low reading will have the output electrode. We're not going to go into all the details of using filters, because there are filters. I'll mention it on passing. There are low pass filters and high pass filters. So we know that acute disease ranges between 0 to 1,000 hertz, 1 kilohertz. And chronic diseases are from 1,000 upwards. And in this particular case, the professional goes up to 81,000 hertz. So if we are absolutely certain that it is a chronic disease, we can turn on the low pass filter. And what that does is it eliminates the frequencies that are coming out of the device from 0 to 1,000, which would cover the acute disease. But because we're not dealing with an acute disease, we're dealing with a chronic disease, then we can just eliminate that, and that speeds up things, because now the device will start from 1,001 hertz all the way up to 81,000 hertz. Or we could do the opposite and turn on the high pass filter to cancel out these frequencies and just leave these frequencies. So there are ways of choosing which filters depending on the potencies that you're testing in VRT mode. So when you're doing your bioresonance testing and you are using a D3 potency of, let's say, the prostate or the tonsils, and it resonates, it comes up positive, then you know you're dealing with an acute problem, because this is the acute range, the subacute, and the chronic. If it's a D60 ampule of the tonsils, then you know you're dealing with chronic tonsillitis. So the filters can be adjusted accordingly. When I teach bioresonance diagnostics, I often say to new practitioners, don't play around with the filters. Just leave both of them off, and that way the device will go through the whole range of frequencies. Because sometimes you can have an acute and a chronic problem in at the same time in the same patient. We're pushing on for time, so let's quickly go through the rest of the slides, at least so that you can get a concept of what the Deta professional is capable of doing. Here, we're treating allergies with bioresonance therapy. So we place our input and our output, but instead of just having the electrodes, we also have our resonator plates. And on the input, we will place, in this case, it's olive pollen. So we will place our olive pollen. And on the output plate here, we will have our placebo homeopathic, so that as it inverts the pathological signals from the olive pollen, it imprints it into the homeopathic, and then the patient takes the homeopathic home with them, and then they can carry on taking those healthy frequencies now, because they're actually inverted, in order to continue treatment. So we can treat with autonosodes. If you remember, autonosodes was pathological fluids or tissues from the body. You can take skin scraping, you can take saliva, you can take mucus from the nose, you can take urine, depending on where the problem is. If it's a digestive problem, saliva is good. If it's a urinary problem, kidney problem, a urogenital tract, then obviously urine is better. And the same thing happens here. You can place the autonosode here, the saliva, for example. In the input pot, in the output pot, you place your placebo, homeopathic, the sugar pills, or the water with a little bit of alcohol added, just to preserve it. And then you can have the patient plugged onto it, because this is bioresonance therapy as well. And you can also place, use the pharmaceutical selector to select remedies, for example, drainage remedies or detox remedies. So you can choose remedies for detoxing the liver, for detoxing the lymphatic system, for detoxing the kidneys, or drainage remedies for doing that as well. So it gives you this capability of doing the bioresonance therapy, but at the same time making a homeopathic for the patient to take home with them, and at the same time also inputting useful remedies into that homeopathic from the pharmaceutical selector. This is treating with electromagnetic therapy and the pharmaceutical selector. So you can actually, the electromagnetic therapy is basically it's called an antenna, and it is a plate, it's a little box with an antenna inside it that emits the electromagnetic frequencies. That's placed onto the body of the patient. It can be placed either on the organ affected, or it can be placed anywhere basically on the body. And this will be giving the electromagnetic therapy, but at the same time we can also have our nosodes included. This is the control panel for the electromagnetic therapy. You can either have it in auto mode or manual mode. We won't go into the details here, but you know, the difference is that you can actually control the frequencies if you know enough about, you know, which frequencies affect which organs or which part of the body. You can control all that. The quantum light. The quantum light is basically a light generator, handheld, which emits colored lights, and of course each color has its own frequency. And this is pulsed. This is the handheld quantum light. So this resonates between 0.1 to 100 hertz. All the organ systems of the body resonate between 0.1 and 100 hertz. The 100 hertz organ is the pineal gland in the brain. This is the highest resonance. Also part of the crown chakra for those that understand Ayurvedic medicine. Now, how do we use this quantum light? Well, there have been researchers that have identified different zones of the body. These are correspondent zones that correspond to different organ systems. If you are wanting to treat an organ system, let's say the heart, and this is the zone, then you would run the colored light on this particular zone. There are also other correspondent systems using the face. So on the face, there are actual zones that correspond to different endocrine organs, for example, different organ systems. And the combined therapy, as we mentioned at the beginning, uses bioresonance, electromagnetic, and quantum light therapy. It combines all of those. So you can have the patient holding the electrodes for the bioresonance. You can be producing the homeopathic that they can take home with them, utilizing either the autonosode you've taken from the patient or from the pathological resonance signals that you're actually getting from the patient through the electrodes. Excuse me. And At the same time, you can have the antenna box on the patient's body, so they're getting the benefit of electromagnetic therapy, and at the same time, you could be working the quantum light on the different zones of the face, for example. So the body now is getting all of this information, healing information, and it can work on many different levels in order to come back to some homeostasis, some balance. So this combined complex therapy is very useful for toxin elimination, for heavy metals, drugs. The Russian doctors that have used this have used it very successfully in drug addiction, in alcohol addiction, to eliminate different microbes. You can also desensitize against smoking, tobacco addiction, and so on and so forth. So this is the control panel for the therapy mode. Just an aside, to learn how to use these devices, I have set up an online course, which is energy medicine, and energy medicine and bioresonance. That's on the Da Vinci College of Holistic Medicine, collegenaturalmedicine.com. And then every 3 months, approximately, here in Larnaca, Cyprus, we run a 5-day intensive clinical training for the use of the Deta Pharma and the Deta Professional. This is a setup for the electroacupuncture. The electroacupuncture is mostly for acupuncture practitioners who understand the meridian systems and the various acupoints that they would need to stimulate and how to stimulate it, whether you're giving energy and which direction, etc. So electroacupuncture is more for the specialist acupuncturist. The professional also can copy homeopathics. We've already talked about that with the Deta Pharma in different dilutions. This is just an example of how one makes homeopathics, what nosodes are. We've already talked about this, and this as well. The organo preparations are the normal healthy organs and tissues, as opposed to the nosodes, which are the pathological or diseased organs and tissues. And you can make homeopathics from the Pharmaceutical Selector itself, so by placing the algorithms of the different homeopathics. And you can make the homochord, so you can make different mixtures of homeopathics at different potencies, again, to give to the patient. Okay, I think we've just about managed. I think it's 1 minute to the hour. So we are just in the ballpark. I hope I've managed to give you in this hour at least a conceptual view of the use of the Deta Pharma and the Deta Professional for both bioresonance diagnosis and treatment. These are cutting-edge devices. They are extremely cost-effective. They have all the digitized ampules that you could ever want to use in a lifetime. You will never outgrow this device, however experienced a practitioner you become. I started many years ago, before digitization came into being, and so I was buying ampules, and I have probably spent tens of thousands of euros on purchasing ampules, whereas here you get all those ampules digitized and stored in the Pharmaceutical Selector of both of these devices, the Pharma and the Professional. If, of course, you can afford to buy the Professional, that is the device of choice, because it gives you the therapeutic capabilities that the Pharma doesn't. The Pharma is only for diagnosis. It can make homeopathics, but it can't actually do the bioresonance treatments, the electromagnetic therapy, the acupuncture therapy, and the quantum light therapy. It's purely for bioresonance diagnosis. So I thank you once again for listening to me, and hopefully we'll be together again soon for another exciting review of bioresonance technology and where this is taking us